ankle sprain. Which is the most common ligament that's going to be involved in an ankle sprain?
Lateral.
And of the lateral, which of the three is going to be the most common?
Epicondyl? No.
Remember anterior talar fib? That's going to be the most common one. Why, when we talk about ankle sprains, why aren't medial ankle sprains more common?
Because the deltoid ligament is stronger.
Mm-hmm.
And the malleolus.
On which side? Yep, all right, good call, guys. So what you would do, remember, you're going to have the patient in a position like this. You're going to secure above like the tibia and the fibula. With the other hand, you can grab the calcaneus. And again, you're just going to go, posterior to anterior and then anterior to posterior. And you're trying to observe. And remember, you're going to always do the unaffected side first, because you want to get a true feel of if there is any significant laxity of it. We talked about some patients are just hypermobile, or they just have over elastic ligaments, tendons, and muscles. So to give you a good feel on if that's their normal give or normal laxity for those ligaments. But in an abnormal finding would be if there's increased movement, either going anterior or going posterior. If there's either a palpable click or an audible click, that can indicate that there is a significant sprain of that ankle. With that, remember we talked about there's 3 different ways that you can grade the ankle. Grade 1 is your mild, grade 2 is your moderate, grade 3 is severe. And usually with the grade 3, that's pretty much, it's going to affect those 3 ligaments that we talked about. So there's going to be a lot of instability. Most likely that patient is going to need some sort of orthopedic consult, possibly surgical consult for that. I would say special testing wise, an MRI, if you were trying to, if you note, significant instability, patient can't walk on that ankle, there's a lot of swelling, a lot of ecchymosis, that black and blue, appearance, and they can't bear any weight on it at all. If you suspect that there's a grade 3, I would, send them out to see an orthopedist. And then you can co-treat at that point too. There's some techniques that you can do to just encourage, the tissues to heal properly, the tissues to heal fast. So any questions on that? So why don't you all try that on each other now? And I'll walk around and